For my Ignite presentation, I have chosen to focus on the movie Toy Story, directed by John Lasseter. The main characters of the movie are Woody, the favorite toy of Andy, Buzz Lightyear, the competition, and Sid, the antagonist. For the presentation, I will be focusing on Buzz Lightyear and how he meets criterion for schizoaffective disorder with a rule out of bipolar disorder. Buzz Lightyear meets criterion A by way of an acute major mood disorder that has both manic and major depressive qualities. While the criterion A for schizoaffective disorder needs to be met, the criterion for schizophrenia must also be met for the client, as shown by when stress during the acute episode was at its highest for Buzz. Disorganized speech was also present with psychotic laughter. Disorganized and catatonic behavior was also present before Woody slapped him, in which for the rest of the episode he presents high avolition to the point of suicidal tendencies. Criterion B is met with the grandiose delusions discussed beforehand, which have lasted the entirety of the movie until the discovery that the delusions were false. Buzz also meets criterion C because he has a major mood shift during the period of this episode and shows signs of mania with major depressive qualities. This also produces the rule out of the bipolar disorder because the grandiose delusions are present within an outstanding time before the episode. Since Buzz is also a toy, criterion D cannot be met since he cannot take in any substances that would negatively alter his mood. During the highest energy portion of the episode, catatonic behavior was also present in the form of rapid eye movements and excessive gesturing. Treatment for schizoaffective disorder is a combination of antipsychotic drugs and psychotherapy. Family or other toys in Andy's in the case of Buzz, family therapy would produce the most effective results, as he can be around other toys that have had similar experiences as he has. Although medication is recommended, it is not required, as quite often people in the schizophrenia spectrum refuse to take serotonin reuptake inhibitors due to the harsh side effects. After the acute episode that Buzz experiences has passed by, most of the symptoms seem to subside for the rest of the movie as he confronts his fears of identity and form a family unit in which he feels purposeful. However, relapse is possible for Buzz due to the possibility of separation from his family or a period in which he would not be reunited with his fellow toys. In conclusion, the schizoaffective episode seen in Toy Story is just one example of how some children's movies have the characteristics of mental disorders, and yet usually they allow stigma for mental disorders to persist by using the willpower of the character and his or her friends to overcome the scenario. To effectively show that mental disorders are naturally occurring and reduce the stigma, more movies should follow the ACT model. Thank you.